Hi, I'm Dr. Jade Husby with Stanford Hearing, and we're here today with some tips and tricks to help ensure that your hearing journey is a success. In this video, we are going to talk about how to clean a behind-the-ear hearing aid with tubing, okay? Most important thing to note when you have this kind of hearing aid is that if you cannot take your fingernail and leave an indent in this tube, it's time to come in and have your provider change it. Some patients need that changed every month. Some patients can go 6 months. The average time of a tube is about 3 months, okay? So keep that in mind. Otherwise, biggest things you can do when cleaning this kind of hearing aid, you can take your brush and you just can kind of wipe and brush off any excess. You can take a plain tissue and kind of wipe, clean off there. Or you can take any variety of kind of cleaning string. So you don't want to do this too often because what you can actually do is you can shove the debris down in there and up the tube further and actually malfunction the hearing aid, and then you'll have to come in and see us. So if you do this, you'll want to be very, very careful. You can take any of these variety and you can kind of put it in there and just kind of clean that out with that piece. There's ones that are a little thinner like this here, or you can just kind of get in there and try to get out any little piece maybe of wax that's being kind of stubborn. Again, you want to keep in mind that if you cannot indent this tubing with your fingernail, it's time to come in and see us. So really, clean it, wipe it nice and good, and see if you can get any of the debris out that's stuck in the tubing. If not, you'll likely need a tubing change. Stay tuned for some more tips. If you have any other questions or concerns relating to this video, please visit our website or call us. We look forward to hearing from you.